Hello everybody, I am Dr. Vishnu Badri. I am Medical Director and Chairman of Sri Rudra Ayurveda Multi-Speciality Hospital, Alappuzha, Kerala. Today we will talk about hemiplegia. Hemiplegia, as we know, is a condition where the one part of our body loses its ability to move about. Or sometimes even a face may be involved when the facial nerve is involved, and so the complete half of a body may lose its ability to move, or sometimes even it can affect the sensations also. Sometimes there is no sensation of the part of the body which is affected. So, in Sanskrit, in Ayurveda, it is called Pakshakada or Pakshavada. According to Ayurveda, it's a Vada Roga. See, lot of structures like muscles, bones, joints, and nerves, and even blood vessels, which are related to the locomotion of the body, is under control of Vada, the prime among the three doshas. And when this Vada is vitiated, it affects either of these structures, which will produce difficulty in movements. Hence, Pakshavada is one such disease when the central nervous system, the nerves of the central nervous system or the cells of the central nervous system is affected or vitiated with Vada, thereby producing difficulty to movement of one part of the body. In cases where there is only a single part is affected, like one hand is affected, it is called monoplegia. It is called Ekanga Roga in Ayurveda, and when it is affecting the whole part of the body, it is called quadriplegia, and this condition is called Sarvanga Vada. So, whatever it may be, it is purely a Vada disorder, and there are many situations which can lead to hemiplegia, Sarvanga Vada, or Ekanga Vada, monoplegia, or quadriplegia. And among them, many reasons are there. Among them, stroke is a main reason. Apart from stroke, tumors, cancers, especially space occupying lesions, even which are benign, also can produce Pakshakada or hemiplegia, and also conditions like trauma of brain and spinal cord, and sometimes infections like encephalitis can also produce hemiplegia or Pakshakada. Apart from that, high sugar levels, low sugar levels also can affect the nerves in the central nervous system, thereby producing sometimes Pakshakada or sometimes Sada, which is another condition which is a minor condition which will not produce inability, but it will certainly produce numbness of the body. So, Pakshakada, as I told, stroke is the main reason for Pakshakada. There are two types of stroke. One is ischemic stroke, and the other one is hemolytic stroke. Strokes are mainly caused by either by blocks to the blood vessels which are supplying to the brain, or by rupture of the blood vessels which supplies the brain. Major blood vessels may rupture, producing some clot in the some big clots in brain, thereby reducing the nutrition and oxygen to the cells nearby, causing death to the neurons of that area, thereby producing hemiplegia in the body. Or else sometimes the blood vessels are blocked with plates, producing ischemia to the or loss of blood circulation to some regions of the brain, which in turn causes the death of the cells there, and thereby causing hemiplegia or paralysis of one part of the body. So, as I told, shock is one among the main reasons of hemiplegia or paralysis. Paralysis has got so many symptoms like tiredness, general weakness of the body, and sometimes one part of the body may completely be affected, so that the movements of that part will be completely lost. Or sometimes even when facial nerve is involved, facial paralysis also will be there. Bell's palsy is called. And sometimes apart from the paralysis, many symptoms like burning, sometimes itching, and even sometimes pain, sometimes numbness, all will set in along with this paralysis of one part of the body. And even the gait is affected, so that patient may not be able to walk. Sometimes he may not be able to talk. Sometimes even the memory may be lost, and sometimes even though he is able to collect what you are saying, but he may not be able to tell you back the answers because he cannot coin its words. And in some conditions, some patients, the memory may be affected, so that he may not identify people, or he may not be knowing who he is after and what he is, etc. And in some conditions, the patient may be knowing everything, but he will be in a depressed state, or sometimes in an anxious stage, what about to be coming us, and such thoughts will be haunting him. Anyhow, apart from the body, the mind also will be mostly affected in hemiplegia or Pakshaghata. As I told, in Ayurveda it is called a Vata Roga. Vata is when Vata is vitiated, this type of Vata Rogas are produced. When Vata is vitiated in the central nervous system, or in the main nerves of the body or central nervous system, there it produces shock or anything like that, which will in turn produces Pakshaghata. Mostly the Vata vitiations is of two types. One is due to Tadhuchaya, and the other one is due to Srodoroda. Srodoroda can be said as the blockage to the vessels which supply the blood to the brain, and Tadhuchaya can be correlated with the clot which produces blockage of nutrients and oxygen to the cells, thereby causing death of the cells there and producing paralysis. The treatment of paralysis or hemiplegia is in tune with the Ayurvedic principles, and so many other many methods are being adopted to treat Pakshaghata or paralysis or hemiplegia. Anyhow, it's better to start the treatment when the first stage is over and patient is stable. At the earliest, we have to start the treatment, as if Ayurveda can produce tremendous effects on people who are paralyzed. The main thing is that we should start the treatment at the earliest. Mostly when there are so many methods of treatment for that. Panchakarma is one of the main treatment for this, and among them the Panchakarma, Nasya, Vasti and Virejana are being used as the main sort of Panchakarmas in Pakshaghata. But before doing this Panchakarma, we have to prepare the body to adapt to the Panchakarmas. For this preparation, usually we do many types of Sedana Prakriya and Snehana Prakriya or Rushana Prakriya. Mostly in people who are having Srodorodatva, then mostly Rushana will be done earlier. Rushana will be done by poultice made up of powders, and sometimes Baluga Seda, sometimes Ruchapinda Seda, and even Dharas with Dhanyamala, etc. are being used for this type of Rushanas. And after that Rushana, when the pain, stiffness, and edema has been subsided, then we will start Sneha Sweda. Sneha Sweda means oilation and sedation, or oilation and fomenting. For that, many types of oils are prescribed in our classical tests. Among them, doctor will select some oils which will suit the prakriti, the state of the patient, or the condition, or the condition of the disease, and many other factors are considered before taking the medicines. And such factors are considered, and some oils along with internal medication will be suggested, and that oils, after applying this oil called Abhyanga, steaming is done. Steaming can be done by steam bath, or many other methods are also used for steaming, like Nali Seda, Sangara Seda, Prasara Seda, etc. And after Seda Prakriya, many other Sedas, like using poultries like Jambira Binda Seda, Patraporla Seda, like Sedas are also being used. After preparing the body to receive the Panchakarma, then Panchakarma starts. Nasya is one among the main Panchakarmas being used in Pashagada. Nasya, as we know, is directly pouring oil to the nostrils so that it will reach the brain cells also. And when medicines are taken, doctors will select medicines in accordance with the nature of the paralysis, nature of the stroke which affects, or nature of the condition which produces the hemiplegia, or the cause behind the hemiplegia will be considered, and medicines will be selected accordingly. Nasya can be either Shodhana or Brahmana. Shodhana Nasya is usually used when drainage of either clothes or blocks are there, and thereby the clothes or blocks are being removed. And in Brahmana Nasya, the Brahmana Nasya is mostly applied when cells are being damaged. So firstly Shodhana Nasya is given, and then if needed Brahmana Nasya is will be given. And the other Panchakarma Chikitsa which is important in hemiplegia or Pashagada is Virejana. Virejana is purgation by giving medication through oral route. Many types of medicines are being used for Virejana. This will be decided according to the prakriti, and the dosha predominance, the age, and many factors are being considered before giving the purgation. And another Panchakarma which is very crucial, very important in Pashagada or hemiplegia is Vasti. Many type of Vasti is being used in Pashagada according to the patient's condition and disease condition and prakriti of the patient. Here we mostly use Yoga Vasti, which is an 8-day program. Sometimes according to the condition, sometimes 15 days of Kalavasi, and sometimes even 30 days of Vasti may be required. That depends on the condition of the patient. Anyhow, giving this Panchakarma after Sneha Seda, Rushna, etc. will produce tremendous impact on Pashagada patients. And along with that, we here use some physiotherapies which can be used in tune with the Ayurvedic treatment, and yoga especially, and of course yoga is used here, especially yogas like meditation, as I have told earlier, that most of the patients will be affected psychologically also. So meditation can give tremendous impact on the mind of the patients. And also apart from meditation, pranayama, different asanas which the patients can do will also be incorporated in the treatment. All these treatments will give tremendous impact on patients But only thing is that we have to start the treatment at the earliest in order to reduce the effects of hemiplegia on patients. Anyhow, the Ayurvedic treatments, one thing can be assured, that Ayurvedic treatment can improve the overall health, overall well-being, and reduce the psychological stress of paralytic patients. Thank you.